symptoms. Now, symptoms of iodine deficiency, this is why there's so many of them. And so they, again, I told you a minute ago, they cross over a lot with thyroid being too low, right? So hypothyroid, I would say, is one of the disease states of an iodine deficiency. And those symptoms, fatigue, brain fog, muscle pain. Okay, we can add more to this list. What else would we say happens? Hair loss. We get eyebrow thinning, especially the lateral third of the eyebrow. A lot of times we'll see constipation. Are very, very common symptoms. Again, these are very common symptoms of hypothyroid, which is caused by iodine deficiency. Now, if we're talking about other diseases and other issues, failure to thrive. This occurs in children trying to grow. We see this a lot in countries and in regions where iodine is very poor in the soil and there's no supplementation in place. So FTT, failure to thrive, that's growth and developmental issues that can occur in infants. We'll see cretinism, or mental retardation, in children with iodine deficiency. Women and men, decreased fertility. Goiter, which is a nodule in the neck. It's what happens when you don't have enough iodine, is the thyroid gland, it gets bigger as a result of trying to produce thyroid hormone, but it doesn't have enough of the raw ingredients. And so the follicles in the gland itself actually grow, get bigger, creating that goiter or that nodule in the neck. So that nodule in the neck, that goiter, again, is oftentimes a sign of iodine deficiency. And then we have other things that can occur that are quite common. Fibrocystic breast tissue. So women, if you have a lot of breast tenderness and breast pain, this a lot of times can have to do with iodine deficit. Iodine also plays a role in progesterone production. And so again, very, very important for healthy breast tissue. So hypothyroidism, it can kill you, right? Ultimately, low iodine can cause you to die. So it's an important nutrient. It's an essential nutrient. What does essential mean? Essential means your body cannot survive without it. Your body cannot function without it. And so one of the questions I sometimes get is, am I allergic to iodine? We'll get to that here in just a few minutes. I want to talk a little bit, and we'll bring this up and blow this up, about gluten in iodine, because it's a common, where do we go here? This is a common problem that we see in people with gluten issues. And so this is a recent study done. It was a longitudinal pilot study done on non-autoimmune thyroid disorders as a common finding in gluten sensitivity celiac patients, more frequent than in the general population. And so the authors of this study set out to understand why. Why is that happening? And here's what they found, because this is the first time it's ever really been studied specifically for celiac and iodine. We found that iodine absorption in celiac children is impaired compared to the general population. Okay, we should regularly, and their conclusion is we should regularly reinforce the need for proper iodine intake in celiac disease patients to reduce iodine deficiency risk. Why is this so important to understand? Well, I think it's in what I just read to you, but it's more common for hypothyroidism, non-autoimmune hypothyroidism, but actually it's also more common in autoimmune thyroid disease. But specifically, non-autoimmune thyroid dysfunction is more common in celiac patients, meaning what they found is iodine deficiency as a result of gluten-induced intestinal damage. Now, that being the case, if you've got a history of gluten sensitivity and you never had your iodine checked and you're struggling with low thyroid and you don't know why, we can try to make that correlation a little bit more clear. But the other thing we know, aside from the autoimmune, or aside from the non-autoimmune, in essence, the iodine deficiency aspect, is we know that celiac actually have a greater tendency or greater risk of developing Hashimoto's, which is the autoimmune version of low thyroid. So we know that both can occur. The autoimmune process can occur, but the malnutrition process can occur, leading to low thyroid hormone function because of iodine deficiency. So that is something that you also want to understand. Those of you following me on the gluten-free diet, you want to understand that it's important to monitor it and it's important to measure it. Ask your doctor to measure it. If they're not measuring it, ask them why they're not measuring it. Take them that research study, screenshot these studies. And if you subscribe to my newsletter, you get access to all this information in your inbox. It's free. All you have to do is go visit us at glutenfreesociety.org. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.